Yes.
Please, you introduce yourself for your friends and our folks, please.
Thank you. I'm Mina Niasary and the founder of Modern Midwifery and Consulting Center in Iran. I said that in the past life. It's when I didn't become a manager suddenly. It has a story behind it. A brief. When I was in the school, I was always the first, for example, in Science Olympiad and Math Olympiad. And also, I was always the top 10 in the country for the pre test before the examination, yes. And that's not good, because it's make me proud. And I thought with myself that if I don't be a doctor, who else gonna be? So I didn't try so hard, and I failed. In the examination when the other competitors go ahead from me, and I left behind. So I accepted in 3 courses: midwifery, biotechnology, and Spanish languages in the West of University in Tehran. But I didn't know anything about midwifery. I thought it's like nurses somehow. And thanks to hands of God, I got married in that days. And my mother-in-law was a midwife, and she's one of the perfect midwife in our city and in country, because she's working Iranian traditional and herbal medicine. And I could learn about the midwifery better when I connected with her. I practice in her office and learn about Iranian traditional and Islamic medicine. She was very perfect, and we treated infertility all over the country. Comes to her office, and that was really a good experience for me. But it didn't satisfy me, I was always wanted a job that I be the manager, I be the top of them, and
you are the leader.
Yes, I didn't like to get orders from the others. So I try to be for myself and earn money by my own. I tried many jobs, and for example, when I was 18, I was hard when I was 18, and I go to the insurance services and answers the call and set the meetings, and that was my job, to introduce the insurance service. Yes, and all jobs I tried. I go to the healthcare service too for 2 years, and after that I try to have my own business, but I have no money. When I say no money, it really means without a penny. Because that was really hard to me, because I don't have a rich father or rich husband, and I should try by myself.
Very good.
Yes, and I think that was my brief story about how I became a manager.
You were always on your foot. Very good. I appreciate it. Most of the entrepreneurs, most of them, they come with this background. They are so curious. They like to try different jobs and different activities. They like to have experience of different field of work. And most of them are very smart people. Sometimes even they call them, they are hyperactive.
Yes.
They are not sitting in one place, and they are running from this tree to that tree. So that is completely understanding. That's why you became as an entrepreneur. So fantastic. So we want to know that how you are managing your clinics. You are even doula. You are working as a doula.
Yes.
Plus, you are managing your clinic. In the meantime, you are doing herbal medicine, practicing in your office. How you manage everything together?
In these days with Corona, COVID days or before it.
Yeah, before that, first you tell me about your routinely work. Then after that, we will come back to Corona topics.
Okay. I'm practicing acupuncture or
I caught you because I want you to tell that because you said you did not have any big assets or any fund investment background. You started this business by your own.
Yes.
And so I wanted all of our audience, they know how it can happen, how you could start this business without any financial support. Does it happen? And it can tell us about that.
Yes, I get a loan from the bank at first, and that was really hard for me to pay the loan because I can remember that so many nights I cried so much because I couldn't pay that loan, and that was really harsh time for me. I have to quit my job from the healthcare services because I want to concentrate on this my new job as the midwifery center. And on that time, because I need money, I tried, maybe it's ridiculous for everyone, but that's a time for me that passed, and that was, that is one of mine, it's, I can't take apart a history from myself. On that time, I was a school driver because it didn't so much time. That was a little time from 2 hours in the morning, and the money was good, so I had to do this job. And yes, and besides, I passed my loan. I pay my loan, and I could concentrate on my business. And I was always try to learning because I think when you are even 70 years old, you must learn from the others. And I participated in many courses, and one of the best of them was internship with you in BAM. That was a hard time for me, I said, on that time, and I didn't have even paid that course, but I get borrowed from someone and participated in the midwifery internship in BAM. That was really good for me, and that was a milestone for me, I think, because after that I tried so hard. I always think that you should ask God, because he said that, ask me about your life and I will pay you, I will give you, and even your afterlife, I give you both. And yes, I always ask him and his... yes. And beside them, I have a powerful woman beside me, and she's my mother. She always be next to me and encourage me. And when sometimes I give up, she said, "No, you must go on." She's wonderful, and I thank her so much.
Always strong girls comes from strong mothers. Don't forget it. Always is like that. I appreciate you, and I can tell to all of our friends that what I found from Mina, I had a short time, only 3 days I stayed with her in internship in BAM. But what I found for her, she has very, very business-minded. She's very business-minded. In the meantime, we were practicing in internship. She was trying to open some business way and trade up rose water with other countries. And as soon as I got some order from some businessman from some other countries, she went, after finished her internship, she went to that city, collect those water, rose water samples, and brought it in airport, delivered to
a flower.
It is what I will understand, because maybe everybody will not get this point. But for me, as 20 years I was in this industry, and I experienced different talented students and entrepreneurs around myself. From that point, I understood she's real and she has a very brilliant future. Hard work, commitment, multidimensional thinking, risk, accepting risk to reach whatever she likes, because it was not easy to get a loan from Iran. As you know, Iran loan is more than 15% interest rate, right? It's that darshad.
Yes.
It is in Iran, if you get loan, is 18% till 28% interest rate. It's not a small thing. Even the men cannot come through that. It's not a small thing in Iran. So please don't compare with your own country that your interest rate is 4% or 5%. No, in Iran, it's not a small thing. One more thing is not getting approval for the loan in Iran is not simple. You have to try you have to go through many protocols. You have to collect many documents that prove you can pay your EMI, because they will not give loan to everybody. The EMI is so much huge and everybody cannot do that. So you have to bring enough proof that you have that much sufficient financial background that you can come throughout. I'm explaining this situation for our friends that they know that in Iran, being as entrepreneur is not small, especially as a woman.
Yes.
Okay, I don't want
you
to
must be so brave.
Exactly,
you must be so brave.
Yeah, and hard work and a strong and struggling woman. Very strong.
On that time, I think maybe 24 hours in a day I worked.
This is a very, very huge job. And I know that you are even managing your social media, you're studying hard, because hire some employee to run your social media is not very low payment job. So you have to run yourself, because otherwise you have to be dependent to others, worker, laborers. I know this. So I'm added, because I found it from you, how much you are trying to learn and how much you are trying to manage your other dimension of the business. And even you are working at doula, managing your center and encouraging other midwives to come in your team. I want to tell you, one of our speakers, she was Fatima Qudsi. She was introduced by Mina. She's a researcher midwife and she's working in her team. She's a very good leader too, bringing the toughest in her team. I love it.
Thank you.
Sorry, I'm talking too much.
No,
so Mina, tell us about how you are managing these days with COVID-19 crisis.
I'm practicing in my office in midwifery clinic, aqua prenatal, but that's left behind in this COVID. And I do acupuncture and acupressure for managing the women diseases and also inducing labor and the birth. And Iranian traditional and herbal medicine beside them. And in these days that every woman in this, every woman when it comes to me, she says she don't like to go to the hospital because she fears about the COVID. And I help them to be here in this clinic, and I helped her to inducing the labor just by the acupuncture and just by Iranian herbal medicine. And Yes, and inducing labor, when she dilated maybe 7 or 8, we will go to the hospital and give birth. Because in Iran, we don't have, we can't.
Available hospital near them, so it's not advisable. But I give you some good news. I heard nowadays that Isfahan Midwifery Association, they are trying to find some solution to start home birth in this coronavirus management. And
That's
I heard
really
from
good.
Iran, and I heard from Iran Scientific Midwifery Association, Dr. Khodakami is trying too much to negotiate to start up this protocol, and most midwives can do this job at home. This is very good news I heard.
Yes, the midwives in Isfahan are very talented, and yes, and they are strong. I asked home birth about for home, but they say me no, it is impossible.
Oh, and you know, girls, friends, you know, Qom was the first city infected by coronavirus in Iran, and it was the high rate of disease plus infected person. Then after Qom, it reached to Tehran and other big cities. So they are engaging a long time with that and managing very well, very well. It is one of the religious cities in Iran and very crowded visitors going in that city. So controlling that city is not a small thing. Yeah. So can you tell us something about how you do this herbal medicine? Which kind of herbal medicine you are using for induction of the labor? It was so fantastic that day you were talking about some infertility treatment, and now you are talking about induction of the labor by herbal medicine. Can you please teach us something about these tips?
Yes, of course. You know, there is some herbal that we called it geshniz. I don't know.
It is geshniz, dear friends. What we call it? We call it coriander, I guess. Yes, coriander. Yeah, coriander.
Yes, and I use it from the 38 weeks pregnancy, and really helps to to ripe the cervix. It really helps it. Yes, as tea. You know, they should use it as a tea.
Okay.
And it helps, and I use. I should.
How you advise them to take this herbal?
I use this instrument for inducing labor, for acupuncture. I use it.
Acupuncture machine.
Yeah.
Oh, very good.
And it really helps me.
It is acupuncture or acupressure? Which one is it?
Because it has some electronic signals. Yes. For acupuncture is in 3 ways. You should at first use it by acupressure, just tip your fingers, and the next one is using this instrument, and the third one is to using the needle.
Oh, you can use needle.
3 ways.
I think they will get answer with these 2 types, right? Without reaching to needle.
Yeah,
they will get answer with these 2 techniques without reaching to needle. Like they don't need needle that much.
Okay, because the pregnant ladies are afraid from needle, and in my experience, the needle gives so much energy from the mother. But this instrument and just acupressure just balance the energy to the for the mother.
Very nice. What about that coriander tea, herbal tea? How many times per day you advise them to drink that herbal tea for stimulation of the labor, for induction of labor?
1 teaspoon in the glass.
1 cup.
Yes,
1 cup of, or 1 glass of
yes, 1 glass
hot water.
Yes.
Okay, and how many times per day they have to drink that?
Just 1 time.
Okay, so 1 spoon of coriander leaf or coriander powder, they have to add to the boiled water, 1 glass of boiled water.
The coriander seed.
Coriander seed? Oh, okay,
yes.
not seed. Seed.
No, seed.
Oh, lovely. Then they put on the boiled water, close the boiled water, cap of boiled water, close the cap, and let's slowly
for 10 minutes
by steam. Okay.
Yes.
That slowly these herbal seeds can influence and penetrate inside the water. Okay, very good. What else you are advising them for stimulation of the labor? For example, a lady comes with 41 weeks. In Iran, we cannot give them 42 weeks. 41 weeks of pregnancy and is near to post-dated. So how you will start, what you advise them for that?
In many researches shows that the saffron can help them, but nowadays it improves that increases the bleed for women in labor. So we didn't use, so we didn't use it, and also the kerçek oil. Castor oil.
Yeah.
And castor oil, and we didn't use that because it influence on the baby and makes mechanical, makes the baby mechanical, and we don't use it. But I experienced the oil بادوم یادم رفت.
Almond oil.
Almond oil, yes, that's better.
Oh, how do you advise them? Castor oil or almond oil?
Almond oil. I didn't use castor oil because it makes mechanical.
Meconium stain, because it shows that there is some meconium step in the sign at the time of the labor. Okay.
Yes. We just almond oil for 1 spoon in 1 day. In 1 time in a day, from 39. Yes, from 39.
From 39 weeks, you advise them 1 spoon almond oil. They have orally. With 1 spoon, they have orally per day, once per day.
Yes.
Okay. And what do you do for breech baby? Do you have any experience to help the mother for breech baby? According to Islamic and traditional.
Yes, the last one was a VBAC lady. She has the first birth cesarean, and then the next one wants to be vaginal birth. And she came to me in 37 weeks, and she said the baby is breech. And we tried to use some position from I learned it from yoga position.
Like yoga position, or you did ECG?
Yoga positions. We use yoga positions for we work 1 hour in a day, and I make her to do some positions, and the baby became cephalic.
Oh, very good, fantastic, fantastic. Very good. How you are managing your mothers in COVID-19 hospital? Do you have any special hospital for mothers whose test is not positive? They are clean without COVID-19, or you have some all of your hospital that is infected by that, you have to take normal mothers to that session.
We have 7 hospitals in Qom that give births, but in this time we have just 3, and 4 of them are working just for COVID, and 3 of them are for the women who are not specific signs, for example, fever or coughing.
Oh,
Yeah.
so you can take them to those 3 hospitals. That is for
Yes.
general clients. So do you have enough medical device or medical protection like mask, gloves?
Yes, we use it, mask. Yes, we use everything, mask, and the hand.
Glove.
Yes, this, and also the eye support, and woman and pregnant but had to use mask almost also.
Oh, very good, fantastic. Did you have any mother with COVID-19 or no?
No, I just have one mother that she had fever, and they told me she must go to the other hospital. But I work with her in her home, and she was 9 dilation, and she has no time to go to the other hospital, so they had to give her her birth. But after that, the test was negative.
Alhamdulillah. Yeah. Thanks God. Thanks God.
Thanks God. Yes.
How is managing breastfeeding?
You know, when they come to the office, I first their fever, but she hadn't any sign. But when she goes to the hospital, she had fever.
Oh, that's why. You were suspicious about her, then they did the screening test to check for that. Okay, good, great. So you checked all of the mothers before
all of them.
Going to the hospital in your clinics. If they are not, they are not infected, so you will take care of them. Otherwise, you will refer them to the hospital to take care of as a COVID positive cases. Okay. So what you do for breastfeeding for mothers in these days? Do they do breastfeeding properly, or you don't advise them?
No, we did it. We do it very well, because it isn't important. It doesn't matter when they have no sign about the COVID. We didn't worry about to breastfeeding. Yes, we do it. And in hospital, when they give birth, we do a skin to skin contacts, and after that, we start the breastfeeding in the hospital.
And you initiate breastfeeding at the time of the birth, right?
Yes.
Exactly at the time of the birth. Very good.
Yes.
Do you follow skin to skin with father at the time of the birth too? Okay?
In my city, the fathers couldn't come to the hospital, and also with this COVID, all of the hospitals and all of the fields shouldn't let the people come to visit their patients. It's forbidden. Yes.
It's because of COVID.
Yes, because of the COVID, it's forbidden to visit the patients, and so the parents, the husbands can't come to the hospital.
Before that, they were coming, right? Before COVID problem.
Just one hospital.
Only one hospital. Was that? Very good, fantastic. You are doing aquanatal exercise practice for your mothers, I heard, right?
Not myself, but one of our midwives that comes to your courses, aquanatal courses that you she participated, and she runs the aquanatal, yes.
She's your coaching. She's working under your leadership. Excellent, fantastic. So you are running a very good teamwork in your clinic, and all of them are very specialized and very fantastic job, as I saw from all of them. Very good, fantastic.
Yes.
So I think I can turn on the comments. Let's see what our friends wants to say. And we will answer the question. Now we reach to the time of Q&A. Please, dear friends, if you have any question, you can ask here. Mina had very nice experience about treatment of infertility, and she had very nice advice with some special herbal medicine in Iran. Can you have a small explain about that?
When the first woman comes to the office with infertility, we should see all of her tests, and maybe the husband's sperm analysis or HSG and everything. And for one reason, we can manage them. It's not generally. It's case by case, different.
Yeah. You analyze all of them and do consulting each case by case.
Yes, and we have some.
Yes.
And we have some complex herbal medicine. Not just one herbal. It's for example 4 or 5 herbal that mix together, and we should give them.
Oh, good.
Yes,
the name of this herbal, you told me something that, because I remember in BAM you told me that only that powder is only available in south of Iran, and only one season from that tree would only can find this powder. Can you explain to that?
The name of the powder was Tal, I think.
Tal.
Yes, and it is from the palm, yes, and palm trees, and it helps the men to have a strong sperm when the sperm analyses are, for example, slow, and it could help them. This put, yes.
Increase the sperm motility and sperm volume. And I remember that they were telling us that how we can find this powder. It is only from male trees, because palm trees, they have male and female. Just this one can be found through male palm trees, and only it happens in some season. Exactly, I don't remember. So it is very expensive powder, but it's very practical. I thought that maybe, because I heard in some countries like Pakistan and India, they're using this, as you advised me, that maybe they have it even. So it is very practical. It was Ibn Sina medicine, it was, or no? Oh, I think our connection, again, we miss our connection. Oh. Miss this connection, unfortunately. Okay, dear friend, I think we lost the connection, unfortunately. We had very nice, fantastic session with Mina, and we learned from her how to be brave, how to start business, how to be so challenging and so much powerful. Don't fear from barriers, just start up and trust to God. We learned from Mina that we don't need to have a strong, rich man behind us. We can do whatever we can through our trust to God and our power, energy, and our mind. We women can do many things by ourselves as an entrepreneur lady. So please just trust yourself, trust to God, and just have self-respect. Then you can do whatever you want. Okay,
sorry, I lost the connection.
It is okay. It's understanding. I have this problem with different countries too. It's not only related to Iran. Actually, we lost our connection for these 2-3 days with some European countries. Even we cannot go through our webinar. I don't know what's the problem.
Because every people in their houses and use the internet connection.
Exactly. And this time of night in Iran, all of the live video is starting.
Yes. We have a new situation all around the world, and it's different. Yes.
It is a fantastic.
And the problems are different. And the problems are different too. Yes.
But you and all of Iranians know how to come out through the problems. They are very brave and they are very problem solving. I saw in 6 years I stayed in Iran, I saw how people know how to come out through challenges and make the best experience through that. You are fantastic. You know how to do it. Welcome. Okay, my dear, for the last, if you have any comment or last word you have to your colleagues, because we are going to
I was just to say more. I want to encourage the others. I always think that the poor people are community overhead, and you should be rich to help the other one. So that's the point that I really wanted to be in that position, God says in the Quran, Nun wal qalam wa ma yasturun. It means I swear to writing. It's really important. I just to say, if you want to start, just give a pen in your hand and just write on a paper. It isn't hard. It's just you must write what you want, what's your plan, and that's for the beginning. But everyone around us, I see they are satisfied for their situation. For example, just a little money every month, and it's enough for them. Yes.
For routine lifestyle is enough for them. They are happy with routine lifestyle, but some person like you, they want to reach to the better and jump to the better position. That is fantastic.
And make the world better place for the others.
Exactly. Very good. Fantastic. Very nice. You're so adorable. Thank you so much for spending time with us. And I know you are so busy. You are managing many work together, but with this much busy schedule, you kept one time to stay with your friends and empower other friends through this live video.
Thank you so much.
Other comments for the last word? We can say
no, just thank you, and thanks Lily Mom for providing this e-conferences. That's really nice and adorable. I appreciate you and your team. Thank you to all.
You are one of the Lily Mom team too as well. Thank you for supporting and your love and all of your passion about your work. Thank you so much, everybody. Thank you. I haven't seen any comments. Everybody just sending love for you, and they're waving at you. Many different color of the love. I see too much passion, and everybody say hi. Thank you, my dear friend. Salam Khan. Thank you. I am missing you too. Hello, everybody. They wrote for you. It is perfect. And again, hi again. Thank you, everybody, for your all hi, for all of this. It was nice as usual. Yes, that is. I believe on that. I am on that. So, thank you, everybody.
Thank you, Fatima.
Thank you, everybody. Thank you, Mina, and wish you the best, successful life and brilliant future as you are brilliant. Thank you. Have a great night ahead. Thank you everybody. ممنون دوستان عزیزم. شب خوبی براتون آرزو میکنم. به امید دیدار تا فردا شب با سخنران حیرت انگیز و کارآفرین دیگه. فراموش نکنید فردا شب 5 ساعت در خدمتتون هستیم. در ساعت 6:30 بعد از ظهرم انشاءالله ما برنامه جشن 13 به در رو داریم. 6:30 بعد از ظهر جشن 13 به در رو حتما ویدیوهاتون رو بفرستید و دوستان خارجیتون میان و میخوان ببینن شما این مراسم 13 به در رو چقدر متمدنانه و در محیط خانه و با اون فرهنگ غنی ماندن در خانه اجرا میکنین، ولی همچنان به این مراسم و به این آیین هم وفادار هستید. خواهش میکنم شیر کنین ویدیو و عکس‌های قشنگتون رو از برنامه 13 به در فردا در خانه ماندن و فردا شب 7 ساعت 7 با سخنران بعدی. مرسی، ممنونم خانم عزیز زینب جان.